Your natural teeth are meant to last a lifetime. But sometimes, even with proper dental care, you may experience problems with your teeth. In the past, injured or diseased teeth were often removed. Fortunately, with today's dental advancements, diseased or injured teeth are often saved. One way a tooth can be saved is with root canal, or endodontic treatment. Root canal treatment is a procedure to remove injured or infected dental pulp. The pulp is the soft tissue inside the tooth that contains nerves and blood vessels. Endodontics is the branch of dentistry that focuses on the prevention, diagnosis, and treatment of diseases or injuries to the dental pulp. And dentists specializing in root canal treatments are called endodontists. Dental pulp is the soft tissue inside the tooth. The pulp contains all the tooth's blood vessels and nerves. It's located in a canal that runs through the center of the dentin, which is the hard tissue on the inside of the tooth that supports the outer layer of the tooth enamel. The crown is the visible portion of the tooth that contains the pulp chamber. The pulp extends from the chamber, through the root canal, to the tip of the root, which is located in the bone. While teeth only have one pulp chamber, they may have more than one root and several root canals. When the pulp becomes diseased or injured, it's often unable to repair itself. The most common causes of disease or injury to the pulp are a cracked tooth, a deep cavity, complications from large fillings, or serious injuries to the tooth. If the infected pulp is not removed, the tissues surrounding the root of the tooth can become infected, resulting in pain and swelling. Pain is not always experienced with injured or diseased pulp, but even without pain, substances released by bacteria can damage the bone that anchors the tooth in your jaw. Without treatment, the tooth may have to be pulled. Losing a natural tooth can negatively affect your oral health. When a tooth is removed and not replaced, the teeth next to it may begin to shift into the open space and cause the surrounding teeth to become crooked or crowded. Teeth that are crooked or crowded make biting and chewing more difficult. They are more likely to have gum disease and tooth decay, since they're harder to clean than straight teeth. Replacement teeth, like implants or bridges, are often more expensive than endodontic treatment. They can also involve more extensive dental procedures on nearby teeth. A natural tooth is always better than an artificial tooth. Root canal treatment often involves one or more dental visits. Your dentist or endodontist must perform several steps of endodontic treatment in order to save your tooth. To begin, a local anesthetic is given to help make the patient more comfortable. The tooth is isolated with a rubber dam. A dam is a thin sheet of latex rubber that keeps the tooth dry during treatment. An opening is created through the crown of the tooth and down into the pulp chamber. Then, any pulp is carefully and completely removed from both the pulp chamber and root canal or canals. Each root canal is then carefully cleaned and shaped. When needed, medication may be put into the pulp chamber and root canals to help get rid of bacteria. Next, a temporary filling is placed in the crown opening. This prevents saliva from getting into the chamber and root canals. If your dentist or endodontist notices the infection has spread beyond the end of the root, antibiotics may be prescribed. As with all medications, use only as directed and call your dentist or endodontist if you notice any problems or side effects. At the next visit, the temporary filling is removed. The root canal is then filled and sealed, typically with a rubber-like material called gutta percha. After your root canal is complete, you must return to your dentist to have your tooth restored. Your dentist will restore your tooth with a filling or a crown. Crowns are used most often because they strengthen your teeth and improve their appearance. When a root canal treatment is performed by an endodontist, it's recommended that you return to your general dentist as soon as possible. A proper final restoration of the tooth is extremely important in ensuring the success of your root canal treatment. Root canal treatment can last for years. The saved tooth performs like the original natural tooth, helping you to chew, bite, and speak. However, just like with all of your teeth, those with root canal fillings can become decayed, develop fracture lines, or get gum disease. After root canal treatment, be sure to continue good daily cleaning habits. Brush your teeth twice daily with a fluoride toothpaste, and floss or use an interdental cleaner daily. Also, schedule regular dental exams and eat a well-balanced diet. By following a good oral health care routine, you can help keep your teeth healthy and strong.